Good morning everyone. I'm Fahima Shirvani, Doctoral Scholar, Center for Management Studies, Jamia Millia Islamia, Delhi. Today I'll be presenting my joint study with Professor Syed Wajid Ali, Senior Faculty, Center for Management Studies, Jamia Millia Islamia, titled Impact of COVID-19 on Utilization and Performance of Healthcare Systems in India. The healthcare system does not work in isolation. It works along with many stakeholders such as hospitals, pharmaceuticals, diagnostic, healthcare equipment, medical insurance, ICT-based support systems, etc. The pandemic has affected not one but almost all these stakeholders. The COVID-19 pandemic has affected the healthcare system in many ways. It has unraveled and thrown a spotlight on deep-rooted challenges in the system and has emphasized on the urgent need to upgrade and improvise the socio-technical discrepancies at 360-degree level to enhance the effectiveness and performance of the healthcare sector. The impact of COVID-19 pandemic on utilization of healthcare services saw reduced services and patient influx, public resistance to preventive measures, mainly due to the lockdowns and the fear of contagion. However, the industry also demonstrated its resilience and ability to bring new products to market quickly, and the cost pressure on healthcare system increased, which is likely to increase in the coming years due to growing health demands and macroeconomic challenges. In the present study, we conducted structured literature review to elucidate the 31 factor enablers that would help in improvising the functioning of healthcare systems, that is, the utilization as well as the performance of the healthcare systems. Generally, when we talk about the sustainability, the social, economic and environmental dimensions are considered. However, we have also considered certain emerging dimensions in our study. The 31 factor enablers that were elucidated from literature review were later on classified into 6 dimensions, namely sustainability dimension, key performance indicators, smart technologies dimension, economic dimensions, organizational dimension, and social dimension. From this, we came to 4 research objectives and their corresponding research methodologies. The first objective was to identify the enablers for utilization and performance of healthcare system during pandemic. Number 2, how are these enablers associated among themselves, to delineate the hierarchical relationship of enablers. And 4th, to develop a hierarchical model to understand the driving power and dependence of different enablers of smart healthcare system in India. For this, we adopted 2-step approach. Number 1 was Delphi method and the number 2 was TISM, that is Total Interpretive Structural Modeling. Delphi technique coupled with literature review was done to identify and classify the enablers. The study was conducted with 32 experts using a 2-stage questionnaire. Number 1 was confirmation of factors and number 2 was classification of factors into 6 dimensions, as I had discussed earlier. These experts were contacted separately so that the decisions were not influenced with each other and to ensure their anonymity. The sample was collected through random convenient sampling and the mode of data collection was online interviews and discussions. For TISM modeling, we first created the Waxo matrix, which was then converted into initial and final reachability matrix, followed by the level partitions, and then we got 4 levels, which were then transformed into the TISM model as shown. At the bottom level, we saw that the economic dimension is there, followed by healthcare system utilization and organizational level enablers, which then led us to smart and intelligent technologies, sustainability dimension, key performance indicators, and finally leading us to smart and sustainable healthcare system. The factor that come at the bottom level of the TISM model is the most driving, that is the most influential factors. And as we approach the top level, we reach as the least driving factors, or you can say the highly dependent factors. That is the factor which is influenced by all the factors which are coming at the lower levels of the model. In Micmac analysis, we see the dependence and driving power of the enablers. Here, as you can see, that the sustainability KPI has the highest dependence power, and the lowest driving power. Similarly, the dependence in driving power can be seen for all the other enablers. The MICMAC analysis shows a matrix between dependence power and driving power having 4 quadrants, namely autonomous, dependent, linkage, and driving variables. The driving variables come at the bottom level of the DISM model, whereas the dependent variables come at the higher level of the DISM model. The linkage variable is the variable which is driven by the driving factor and drives the dependent factors. For example, ED, that is economic dimensions, here consist of health policies, financing, environment and population health indices. So, if the government has a policy in which there is more fund allocation towards healthcare sector, then the organizations will be able to make use of this facility and the schemes in this in the policies for the betterment of the organization and the society as a whole. They will be able to employ or deploy better technologies. They will be able to employ better staff and make use of better safety standards. On the whole healthcare system will improvise and the functioning will improve, hence the performance will improve. Similarly, social dimensions, if the consumer knows that yes, such and such scheme is there for them in the policies, that is the health policy of the government, they will be able to make better use of those policies. Let us take an example of vaccines. Nowadays, vaccines for COVID-19 is being given to the people above 45 years of age, and now from today onwards the 18 plus years are also being given the vaccination. So if the customer knows that such scheme is there, they will be able to make use of it. Plus, if the customer has the access to technologies like mobile registration or e-registration or EOPD, etc., they will be able to make use of these facilities, and hence they will be able to utilize the healthcare services in a better way. And since the healthcare services are driven by the consumer requirements, they will cater to more and more, hence the whole system will improvise. Major contribution of this study is that it identifies which area to focus on so as to make the healthcare system smarter and efficient, such as it is imperative to have a good understanding of the business processes, updation and implementation of smarter technologies as well as green practices is also important. Lastly, all the factors could be measured against their key performance indicators so as to have a time-to-time look at how our system is going. The main limitation of this study is that it considers a generic healthcare system and enablers pertaining to any specifics have not been discussed. Scope for future study includes the similar study can be done for the barriers. We can measure the effectiveness of each enablers, and lastly, the results of DISM model could be probed to see that how smart healthcare system could be used in the development of smart cities. Thank you. For any queries, you can contact me at the mail ID that is faima.sherwani@gmail.com. Have a nice day. Be safe.